Chapter 9, Walsh, Culture, A Challenge to Concepts of Morality by Monica McGoldrick. Please, as we deal with culture, again, look at the cultural continuum. Age, sex, gender, faith system. In family systems, what our family orientation and makeup may be. Disability versus abilities. Sexual orientation. Across that cultural continuum, looking at the sexual orientation, gay, lesbian, bisexual, transgender, transsexual, understanding sometimes that transgendered may mean to some individuals. I feel like I am living in one gender in my body, but I present as a different gender within myself, my spirit. Transsexual sometimes means people who have gone forward with sexual reassignment. There's also intersexed, people who are born with both sets of genitalia, both male and female, or characteristics thereof. Even though we feel like it's a politically pejorative term, some populations prefer to be called queer because they dislike the term gay. Questioning ones that have not quite understood where they're coming from. Allies, people who support, not necessarily are same-sex themselves, but support that population. So the client has the right to self-identify as they so choose. It is not for us to assign labels to them. Ask and they will tell you how they identify. And whatever that is, it is okay. So McGoldrick has done a great deal of work in cultural issues, looking at different models, geographic regions. A great deal of difference in this country between Northeasterners, Southeasterners, Southwesterners, Middle America, Californian, the Pacific Coast, looking at what those terms mean to the people who are coming into session with you. Ask, and you will know. Ethnicity is a group's common ancestry through which shared values and customs relate. Culture is how we act those things out, how we understand those things to impact us. Understanding that in race, culture, and ethnicity, that there are Caucasian families, African American families, Native American families, Asian American, Hispanic, and the Hispanic and Asian do not mean Mexican or Japanese. That among the Asian populations, there are Samoans, there are Polynesians, Hawaiians, Japanese, Korean, Chinese, Vietnamese, Cambodians, Lao, many other Malaysian aspects of Asian families that we do not always think about. Thai. Hispanic families can be Puerto Rican, South American, Guatemalan, Nicaraguan, Chilean, Argentinian, as well as Mexican. Can be families that are actually Spanish, that are European families but come from Spain. Do not make the assumption that you know. And within that are multiracial and biracial and different combinations of families that we need to understand the pressures and the considerations that those families are under and how they understand themselves to operate. Among European families, huge difference between Norwegians, Finnish people, Scandinavian people versus the Mediterranean, the Greek, the Spanish, the French, the Italian people versus Middle European, Germans, Austrians, Belgium families. Finding our identity within a cultural context has a profound sense on our well-being, on our mental and physical health, to feel like that it's okay to be who we are, comfortable into our own skin. Free from stereotypes that these kinds of people present these kinds of issues, but to be able to look at what the positives of any culture brings to their people and what it means to be part of that sense that Maslow's third level of connectedness, of belongingness, having self-esteem, knowing who we are. And the concept of peoplehood versus division, that we understand commonality, that we reach out to each other from a perspective of commonality, that we're more alike than we're different, while we then respect diversity and differences as being part of a huge cultural rainbow to which we all belong. Not to marginalize, minimize other people's families, cultures, race, religion, patterns, faith systems, or absence thereof. Understanding the differences between Jews, Russian or Eastern Orthodox Christians, Roman Catholics, Jordanian versus Egyptian Muslims, and what that may mean. Even in the Middle East, what it means to have a Sunni versus Shiite Muslim, to have a Buddhist. Even a small community as Griffin, we have people who come into our practice that are practicing Buddhists, that are practicing Muslims, that are practicing practice the Jewish faith, or that have no faith system at all. Not always what you consider to be Southern Baptist, Methodist, Presbyterian, Catholic religions that are more common to our demographic region. And understanding that a multifaceted cultural identity and complex heritages impacts our social location and our background in any given context, and how we structure our families, how our hierarchies, alliances, coalitions, subsystems are understood to be. What it means to families from Native American families, who the one-drop rule applies to much differently than African American families who have experienced the social construct of the one-drop rule. Native American families were found themselves with a governmental system that wished to disenfranchise them and not identify them as Native Americans. So if they had any white relations, particularly if it was a white male married to a Native woman, the woman then, her culture was changed in the census records to reflect white. The children were changed to reflect white versus biracial. African American families have experienced the other side of that, which is if they had one drop of black blood, then they are considered to be African American families, or black people, depending on what the term from that particular part of our society was at that time. Essential to understanding culture is to appreciate the interaction between ethnicity, gender, sexual orientation, class, religion, geography, migration, and politics, and how those constructs have socialized together to help families to either to be adapted into their own culture and to be able to be functional within the majority culture, whether it has caused them to assimilate and have their culture lost, whether it's caused them to isolate and not be able to function and operate within the majority culture. A lot of our history of our culture and cultural loss and effective genocide has come sometimes during ethnic intermarriages of families that are totally different, trauma devastation within their own group, loss through immigration, persecution, poverty, slavery, genocide, and many families and different cultures bring this, not just Caucasian African American. The Asian families, Hispanic families, Native American families bring these issues in. Race, unlike culture, is not an internal issue, it's a political issue. Prejudice is a belief system. You cannot legislate against someone's belief system. However, discrimination is an act. An act can be regulated through the legal system, legal code. Racial bigotry, discrimination continues to be a fact of life. It is much more covert, much more hidden, much of a hidden agenda than overt as it was maybe 40 years ago in this country, but still remains the same. Just because different cultures espouse certain values or belief doesn't make their culture better than, worse than, more important than, or less important than anyone else's culture, but part of a larger issue. Looking at family therapy issues, Some cultures are less able to trust or communicate with their counselors. Sometimes in Jewish culture, the desire to analyze, discuss experiences is important for historical reasons, not to have certain issues lost. A lot of times Hispanic, African American, Asian American, Native American families are less willing to discuss outside of their own faith system, outside of their own community and families. Sometimes there's a great deal of embarrassment factors, sometimes with particularly Asian families and some Norwegian families, a huge respect for the counselor as a learned behavior for someone who is considered to be expert in their field, and much more a desire for the counselor to tell them what to do for very directive versus non-directive treatment. Group boundaries, family boundaries may be different. As counselors, we have to decide how we're going to work with these families. If you have an Asian or Hispanic family who is not bound by individualistic thought processes as Caucasian families tend to be, individualism being understood in Caucasian families to be desirable, but in some minority families to be undesirable, you may find that they wish to bring in their large family groups, their partners, their children, their parents, some of those things. Being able to be adaptable as clinicians to allow that to happen so that you are affecting not just the individual but the family as a whole is important. So think about, as you read this chapter, families that you have seen, how open your practice is to cultural diversity, how welcoming it is to people of different cultural backgrounds than our own, and how that can be changed. Knowledge can be gained. Awareness can be raised, heightened. Skills can be learned. Sensitivity and respect have to be innate and intrinsic. So as we go forward treating these families, let's look at those things.